Hi, I'm Lindsay. I'm your nurse today. Could you give me your name and birthday?
Joseph Landon Johnson, 11/14/96.
Okay. I'm going to be doing the assessment on a few different things. So first I'm going to get my gloves on after I've washed my hands. I'm going to notice, first I'm going to start with the skin, hair, and the nails. And I'm going to look at the general appearance. I'm going to look for any lesions, anything unusual. I'm also going to look for anything I think is suspicious, such as moles or anything. I'm going to inspect the general appearance of the skin. Okay. I'm going to be looking for anything unusual. Any hypo or hyperpigmentation, any changes in color, anything. If we were in a hospital or clinical setting, I would have him take his pants off, of course. Now I'm going to palpate the skin, check the temperature, check dryness, the moisture. Make sure that there's nothing suspicious or anything that I need to be concerned about. Next, I will be looking at the mobility of the skin and the turgor, and he has good skin turgor. The way I'm going to tell this is by pinching a small part of his skin on his chest and testing it that way. I'm also going to be looking for any bruising, and I don't see any, so that's good. Next, I'm going to be looking at the nails, and I'm going to be noticing the shape and the texture and the brittleness. I'm also going to check capillary refill, which is good. Next, I'm going to be looking at the hair, noting for an even distribution, which is good. And I want to make sure there's no lesions on the scalp, which there is not. Okay. Have you ever had a self-skin exam? Or
No.
given yourself a self-skin exam?
No.
Okay. If my patient has never had a self-skin exam or given themselves one, I'm going to teach them how to do so. What you need to do is stand in front of the mirror and completely undress yourself. A good time to do this would be before you get in the shower or something. You want to inspect every part of your body that you possibly can. Look at all parts of your skin without any clothes on. Hold your hands up, look at the front and the back to make sure you don't have anything abnormal, any color changes, changes in moles, or anything like that, okay? Good. Now we're going to focus on the head, the face, and the neck. First, I'm going to just palpate his skull, make sure there's no lumps or anything like that. Check the general size and the contour of it, and make sure there's no deformities or any tenderness. Do you feel any tenderness when I touch your head? Okay. Now I'm going to palpate the temporal artery. Okay. And then I'm going to palpate the mandibular joint. If you'll open and close your mouth. Good job. Okay. Now we're going to move on, and I'm going to look at his face. I'm going to look at the general expression, make sure there's no drooping, make sure everything looks normal and there's nothing, no deformities or anything. I'm also going to look for symmetry, just as he's looking at me, and movement, and everything seems to be normal. I'm also going to look for any involuntary movements, which he doesn't have any, which is good. Then I'm going to inspect and palpate the neck. I'm going to check for lymph nodes, or check the lymph nodes, make sure they're not enlarged and they're not tender. Is any of this tender?
No.
Okay. I'm going to palpate the trachea, make sure it's midline. And I'm also going to palpate the thyroid gland to make sure it's not enlarged. If it was enlarged, I would auscultate to see if there's a bruit, but it's not, so we don't have to do that. So we've checked all lymph nodes and the thyroid gland, and we've checked the trachea. So now we get to move on to the eyes. First, I'm going to take this eye chart, and if you wouldn't mind, put that over your eye. Look straight at the eye chart and read the lowest line you can of the numbers.
937,826.
Good. Now put it over this eye and read the lowest line you can of the numbers.
937,826.
Good. And now I'm going to have you do it with both eyes.
428735.
Good. Now I'm going to check the peripheral vision. First, I want you to look straight at me, okay? You can move your eyes, just don't move your head. Tell me when you see my finger. Look straight at me. Tell me when you see my finger.
Oh.
Okay? Tell me when you see my finger.
Oh.
Good. Now I'm going to check his corneal and pupil light reflex. And I'm going to do that by covering one eye. Look straight at me, please. Good. While I do this, I assess the cornea and the iris to make sure everything looks good. I'm going to look at the sclera as well as the conjunctiva and also the lacrimal apparatus to make sure everything looks normal. Okay, and I'm going to look at the eyebrows and the eyelashes, just palpate around the eyes to make sure there's no deformities. Now, if you would look at my finger, follow my finger with your eyes, okay, not your head. Good job. Now follow my finger again. Good. Now we're going to test your neck movement. First thing I need you to do is, if you can, take your chin and touch it to your chest. And back up. Good. Now turn your head left, right, and then back to me. Good. Now, take your ear and try to touch it to your shoulder without moving your shoulder. To one side and then to the other. Very good. Alright. Now we're going to look at the ears. First I'm going to inspect the auricle for the size and the shape and make sure that it doesn't look, make sure there's no deformities or anything. I'm also going to palpate and I'm going to check the tragus for any tenderness. I'm going to make sure there's no discharge or lesions or anything like that. Then I'm going to take a light. If I was in a clinical setting, I would have an otoscope, but I don't have access to one of those. We're going to pull up and back and look in the ear for cerumen or discharge or anything like that. Good. And I'm just going to evaluate the external auditory meatus and the auditory canal. While I'm doing all this, I am going to just note his behavior towards my normal conversation to make sure he can hear me well. I'm also going to perform a whisper test. Can you hear me now?
Yeah.
Can you hear me?
Yeah.
Okay, that's good. Okay, next we're going to look at the nose, mouth, and throat. First, I'm going to inspect the external nose to make sure it's symmetrical and make sure it's straight. He told me he has a history of a nasal fracture when he was younger. I'm going to look, make sure there is no deviated septum, make sure his nares are patent. And I'm also going to check the nasal mucosa to make sure it's intact. I'm going to palpate for the patency of his nares, if you could breathe out your nose. And again. Good. I'm also going to palpate the sinus areas. Okay. Next I'm going to take my light and a tongue blade and inspect his oral mucosa. If you open your mouth, I want to inspect the cheeks, the tongue, the tonsils and the throat area, and the roof of the mouth. I'm also going to look at the inside of the lips, at the gums. Clench your teeth, please. And just look at the overall health of the teeth. Good. And I'm going to take a 2x2 pad or 4x4 and inspect the tongue. Stick your tongue out, please. Stick out just up. There you go. Make sure it moves freely. Okay, and we are done with our assessment. Thank you very much, and thank you.